First, I think we should go through first wave communications, flattening the curve, how that went, what the main strategies were and how they were received. Then we picked up challenges, obviously, between then and now, what they were, why they're there. And then we get straight into the CDC presentation and the new challenges that are facing us. Glenn will cover the effective strategies for communicating risk. And then I think we can just have a discussion about what we would say and how we would say it. So of course, we all knew about flattening the curve. I mean, this was a fantastic communication tool because this graph was very easy to understand. You saw plainly, and most often those graphs were simply flattened and the x-axis was brought in. You saw very clearly what was going to happen, how that would affect you. You understood it. And you've had some agency. You felt like, yes, you know, we'll pull together and we can do this. I can wear the mask, I can social distance, I can stay at home, and this will have a great effect. It's going to work. Successful things from the first wave would have been, of course, flatten the curve. That was genius. We need more ventilators. That was on every news outlet everywhere around the world. It was true, of course, but it was extremely poignant in pointing out the seriousness of the infections. We need more ventilators. Number one, people are sick enough to need them and they don't have them. So, I mean, it was exactly clear what the problem was and how serious it was. Images of overrun hospitals in Italy, for example, were shocking and extremely effective. Everybody understood. And then, of course, there were the frontline heroes. This image actually comes from a video game called COVID-19 Heroes. Frontline heroes, of course, took the message away a bit from government that people don't trust, politicians. Everyone thought, hey, the people who are at the front lines are the heroes. They're doing the work. And yet again, this is really serious. So I thought there was a lot of positive, fantastic things happening with communications in the first wave. George Tannenbaum did these ads for the CDC. This is on their coronavirus.gov website. It's not there anymore. Act like your ex just walked into the party. Practice social distance. Act like the queen. Wear gloves. I know he had fun producing these, and we were in the mood, you know, to be joking, to be together. There are no more jokes on the CDC website. So let's get into really what happened. Here, as I see it, there are a couple of, there's some themes. One from more the left is that vaccination has to do with your social responsibility and intelligence. If you were smart, you would have already had your vaccine. And if you cared about everyone else, you would do your civic duty and get vaccinated. And the rhetoric is getting really rough. On the right, we look at Fox News, you know, some judge just stripped custody of her son, some woman who wouldn't get vaccinated. That's terrifying when you look at it by yourself. What? That's a huge overreach by the government or by this judge. What do you mean? She just doesn't have a vaccine and she's lost her son? The idea of your loss of right is a huge, huge talking point for the anti-vax movement in general and for COVID specifically. Same fear, different day. This is another huge talking point, and that it's just another virus. It's not that serious. Come on, here we go again. And perhaps you'll be happy to know that Canada has not fallen under tyranny. So how did we get to this point? How did this become the rhetoric? Frustration, of course. You know, of course, the CDC amended their flatten the curve images. They extended the x-axis. So yes, we expected it would take longer, but I don't think anybody expected it would take this long. And I don't think people had in mind that the waves would look like this. And I mean, depending on how you count, this would be the fourth or the fifth. So I think people have lost their sense of humor about it. This speaks for itself. And there's a lot of confusion. There was a lot of inconsistent messaging from governments, from politicians. You know, hey, Trump called it the Kung flu. It's not that serious. You know, we don't need to have all of these restrictions. What's the problem? It's just the flu. And then others saying, you know, hide in your house. We're all, you know, your old people are dying. So it was difficult, I think, depending on your news outlet, to know what to listen to. One thing specifically that is still coming back to bite is masks. It's sometimes it's hard to remember, but at the very beginning, when they were talking about masks, oh, stop buying the masks. We need them for the frontline workers, and they don't work anyway. It was several months before the World Health Organization actually said definitively, yes, you should wear them. Before that, it was, healthy people don't need masks. It's okay. So that was confusing. And then cloth masks were good enough. You could wear your cloth mask and it would protect you against droplets. And then they weren't good enough. And you need to wear medical masks or FFP2 masks. And then if you're in America, if you are vaccinated, double vaccinated, you don't need to wear masks at all anymore. And we all know where that's going now. Back to the masks with your vaccination. It's frustrating. And these are the challenges we face. And it's the talking points around masks are very similar to vaccines. You're infringing my rights. Why do I have to wear this? You say so, but I'm vaccinated. If you're sick, why don't you wear the mask and I don't? Things like this. Or social responsibility. How dare you not wear a mask? It's really angry, and masks are almost as bad in this way as vaccines. And I did want to point something out. I've taken a screenshot from the CDC slides. If you look down at the bottom, this is a model that they had used. Masking, source control, 40 to 60% effective. That's you, if you're sick wearing the mask, you would prevent spread by 40 to 60%. You as a not sick person wearing a mask, protect yourself in the range of 20 to 30%. That's not broadly publicized at all. And I think this is a topic that will come up again and again. This is true, but does it need to be said? I'm sure this is a discussion that they have quite a lot at the World Health Organization, at the CDC. It's true, but would this make the situation better? Will this help people understand what they need to do? No, maybe not. So in terms of public sentiment, in most countries, the idea of the government has done a good job handling the coronavirus outbreak has declined tremendously. Except in the UK, they're quite happy right now, where they weren't before. But most countries are less satisfied than they were before. And if you look on the other side, we have between the left and the right in America, because we are talking about the CDC, but it's not so much different in other countries. The Democrats think that this is a serious health crisis. This is a serious health problem by a large majority, but less than half of Republicans feel the same way. What they do all agree on is that this is terribly bad for the US economy. And that's quite uniform, and it hasn't changed. So this is also something that they need to think about, And then there are also differences in what people feel they're willing to do. And it's no surprise, given the last graph, that Republicans simply don't think as many measures are needed as in general Democrats do. But overall, in almost all of the points, everybody is a little less convinced, or a lot, than they were at the beginning of the pandemic. Where you see the most of it is restaurants and schools. People, I think, have some strong opinions about schools being open rather than closed. So things to think about as we discuss further. And let's get straight into their slides. The Delta variant now represents more than 80% of infections in Switzerland, the US, and the UK. In the UK, I think the number is closer to 99. And the number from Switzerland comes from the end of July. It is certainly higher now. It is very transmissible. The CDC uses the R0 number of 5. And that puts it in line, you can see here in the graph, with chickenpox, more or less. And chickenpox is very contagious. And it's more deadly than the seasonal flu or the common cold, and in line with something like measles, or a little worse. So in their models, they're using R0 of 5. And I don't know if you remember at the beginning of the pandemic, we were really upset when we had R0s higher than 1. So that's where we stand now. But we are very vaccinated, which makes a huge difference. Delta is faster, stronger, and longer lasting. I don't imagine they're going to take that tagline from me, but I'll just overview what they said in the slides about the Delta variant. Breakthrough cases tend to have, or they have been seen to have 10 times the viral load versus the Alpha variant, which was the first one. Vaccinated Delta cases appear to be as transmissible as non-vaccinated cases. So your vaccine status doesn't seem to interfere, it doesn't seem to make you less contagious. And they determined this by equivalent viral load when you're vaccinated or not. And they, in the slides, they do mention that the Delta virus seems to remain contagious for longer, 18 versus 13 days, which would have an impact on how long people would need to quarantine, for example, if they're, or stay isolated if they're sick. And it may cause more severe illnesses. Canada, Singapore, and Scotland all showed an increased likelihood of hospitalization. I think Singapore, they went on to show that there was a greater need for oxygen and a higher death rate by around 2-3-fold. And overall, if you're elderly, you are more likely, vaccinated or not, to be hospitalized. And that number in the vaccinated population of elderly people is rising. Now, this is some data that is updated in the slides. They cited a study, the CDC, that it's called the Heroes Recover study. It's a cohort study of frontline workers, and they used about 4,000 frontline workers from 8 different states. They tested them weekly for COVID, and most of them were vaccinated, and the majority with mRNA vaccines. Good. By the middle of April, 91% vaccine efficiency was found in that group. Great. But they updated it in last week's morbidity and mortality weekly, and overall, the vaccine effectiveness has dropped to 80%. But when you pull out the Delta predominant later weeks, it's 66. And that could be a shocking number, but I want to point out 2 things. Number one, 66 is not 0. That's still 2/3 of people will be nicely protected by their vaccine. And 2, if you follow me on the statistics a little bit, what they're saying with this statistic, the confidence interval here, is that they can say with 95% that say the next 100 healthcare workers or so that come in a similar group would display vaccine efficiency somewhere between 26 and 84%. That's almost a 60% span, and that is nothing, that 66 is nothing you can hang your hat on. What they do, I've noticed, and what they recommend is not to say, oh, vaccine efficiency is 66%. What they say is, look, there's a downward trend. We expect vaccine efficiency is dropping or has dropped. And this is another time where, okay, truth in this case is a little bit questionable. Do you tell people, oh my gosh, the vaccine efficiency is 66% now, when you're really not certain at all given that number? Or is it better to simply say, hey, look, it's waning? Because this will have a tremendous effect, and it's already having a tremendous effect on people thinking that the vaccines don't work. People don't want to get, a lot of people don't want to get vaccinated anymore, or they think they need a booster. They think they're not protected anymore because they're vaccinated. So this is a big problem for the CDC and for everyone right now. And next we see, this is an older, and this is also from older data that was taken up to May 21st, which would not have many Delta predominant weeks in it. They found that this is in a long-term healthcare facility, this one, 85% of the elderly were protected from severe illness, 75 for mild illness, and 61 from infection at all. These numbers would probably have gone down when you take into account the weeks that came, but not by a tremendous amount, but like they are saying, expect a decrease. And you have to think about, how would you communicate something like that? I don't envy them. This is important to keep in mind, and what I'm sure they want everyone to keep in mind: the vaccine is still effective. It doesn't have to be 100% effective to still be working and protecting the society in general. If no one was vaccinated and your virus now has an R naught factor of 5, which means if I am infected, I will go ahead and infect 5 people and they will infect 5 more, it would be tremendous. It would be horrible. So vaccination is still, even 66%, even 50% or 40 is still the best way to keep people, or a great way to keep people safe, even if it's maybe not anymore an 8-fold reduction in disease incidence or 25-fold in hospital. If it's 20 or even 15, that's still great. Now, this was something I found, I'm not sure of the right word. They acknowledged, and it's important to acknowledge that vaccine effectiveness against the infection is lower. Okay. And they say, all right, you should think about it. It's like, well, I didn't mention it, not just the elderly have a lower vaccine effectiveness, also immunocompromised. So compared to a healthy person, they're not going to fare as well with the vaccine. Their immune systems are simply not up to it and aren't helping the vaccine as much. So if they say that when you hear the number of the vaccine effectiveness, this is an average for all of us, that if you're older, that if you're immunocompromised or sick, then your risk is different. But if you're healthy, your risk is lower. And then they say, well, how would you introduce this concept and how would you explain it? And for me, I think this is one to steer very, very clear of. And my reasoning is this. This is the vaccine effectiveness of the influenza vaccines from the last, well, they have until 2004. I've given you until 2014. Adjusted overall vaccine effectiveness is between 20 and 50%. That's not the 66. And what would happen if you tell people, oh, 66 isn't bad, look at the flu. And if you think there isn't a reporter, it won't occur to them that, oh, this is similar. What is it with the flu? This would be a tremendous healthcare crisis. Then people stop taking the flu vaccine, and then I have a problem with that part of their strategy. Summary. Delta is different from the previous strains. It's very contagious. They're using in their models R naught of 5. It is likely more severe, and breakthrough infections may be more transmissible, just as transmissible in unvaccinated as vaccinated. Vaccines prevent 90% of severe illness, and yeah, you expect this to go down. NPIs, which are non-pharmaceutical interventions, are essential to prevent continued spread of the current vaccine, spread with the current vaccine coverage. Now, I hand it over to Glenn.
A lot, Anissa. So I just wanted to add to what Anissa said, is to say, okay, really then, as you can see here in the heading, like, what have we learned from the first waves and past pandemics for communicating to publics about the risks? So the strategy of the CDC didn't really contain much about, well, what does this imply? They had some points about, individual risk, etc. But I thought it's worthwhile just looking at sort of what we've learned. So all of this information here is based on studies that have been done during COVID or even before COVID. And actually, I helped author a paper for WHO on risk communication that's coming out soon. So I'll share it with the group where you have all the references in there. So I think the first point is that and this came out when we look at the how people assess the risk, is COVID dangerous or not? And, the fact is people don't assess risk based on their assessment of the facts. It's really based on their past experience, beliefs, their worldviews, and their ideologies. And This is not only for COVID-19, but also some other issues like nuclear waste and climate change are ones that have been cited in the research. So it means that, as we saw, there's a split between the left and the right. So COVID is one where it's been really polarized, and identified your position sort of is often linked to your ideology, and also ideology including religion, the intensity of your religious beliefs. So this has to be taken into account when we're trying to communicate, facts about pandemics. And, the second point is that, like, you probably all know this, but it's proven by the research that basically people believe what matches or reinforces their beliefs. And so even when people are shown that they're factually incorrect, they don't necessarily correct themselves. Even more so, studies show it can reinforce their original views, to reject the evidence that's put in front of them. And the role, of course, of social media in these last years plays an important role. In fact, you've probably heard this or seen this effect. It's sort of like the echo chamber effect, where social media, like Facebook, for example, basically feeds us news articles or comments of our friends that basically confirm or reinforce our own beliefs. It doesn't necessarily open us up to new opinions or new information. And a recent study also by Yale in the US showed that actually social media rewards outrage. The more outrageous your statement is, the more following you'll get, the more likes you'll get. And what they show is that basically it encourages people to be more outrageous in their statements. And also we know that basically, social media also rewards sort of sensational and false news, because it spreads faster on social media, gets more clicks. Studies show, recent studies show, false and sensational news will actually spread up to 100 times faster than confirmed and validated news. So we have to take that into consideration when we think about, well, how are people, getting information and learning about pandemics. And key, of course, is who do people trust? As we saw, who is the messenger in communications is all important, as you know. And so the trust actually is interesting. In scientific and medical experts, the polling done globally shows that actually it's remained relatively high, even increased in some markets. Talking about scientists and health and medical experts, there's really only low trust amongst those that are aligned with a select set of beliefs, worldviews, and ideologies. Those that basically have strong religious views are on the far right. They tend to not trust medical and scientific experts. But the majority of the population in most countries of the world do trust them. At the same time, the global trust studies that are done show that trust in politicians and institutions in general is falling globally, and this has been the case over the past decade. So it's possibly also accelerated by COVID-19. So who is communicating the message is important. And then I say, okay, if you go, Anissa, to the next slide. Basically, okay, so what has it shown that actually, studies have also been done to show, okay, what can work in communicating risk and communicating about pandemics? Certainly the first point is what comes out of the studies is that, we've got to reflect the concerns of the public. So that means that we cannot dismiss the concerns of people that are hesitant or against vaccines. And that's important to recognize in the communications. Also that, unfortunately the facts alone don't stand. Messaging has to be also combined with emotions and compassion. So this also comes out that the scientists will perhaps say, no, the facts will stand, but studies show that unfortunately facts by themselves do not always stand. Also, that question, as we spoke about, that question of the falling efficiency of the vaccines, etc. How do we manage the question of the masks? How do we manage the uncertainty of the science? And this is something that science communicators always struggle with. I mean, studies show that, we should be as transparent as possible. Of course, we're going to prioritize certain messages, but we shouldn't hide information. And where the science is uncertain, for example, maybe the CDC should have said, nearly 2 years ago, well, look, the science on masks is currently not solid enough to give an opinion, instead of saying, no, you don't need to wear masks, from what I recall. That's how I recall it. And also that notion of how can the scientific and the medical experts really be first movers in shaping messages? Still being the first message can play an important role according to the studies. And then, well, what do we do about people that are really polarized? How can communicators work with the elites who can influence them? Because these publics are being, the polarized publics are being influenced by given people who they admire. So how is it possible to work with these people also? Because they're the ones that need to be convinced, to convince the people they're influencing. It's not going to be easy, of course. And then lastly, well, okay, what is shown to work to convince vaccine hesitant people to vaccinate? I mean, there's been studies done on that quite recently. The first one is basically exclusion from social life, like the findings in France, neighboring France, where, for example, when they introduced this pass santé, I think it's called, where basically it excluded you from restaurants and other social events. They saw vaccination rates go up by 10% in some areas of France as a result of this. Another influence on convincing people is actually experience with COVID. So where an individual has experience with COVID, knows someone in their family, they're more likely to want to be vaccinated, even if they're vaccine hesitant. I was recently in Australia a month ago, and the problem is that no one knows anyone that's had COVID. So it's not like in Europe where we all know someone who's had COVID or we've had it ourselves. So in Australia, it's really difficult because the infection rate is relatively low for people to know someone who's had it. So they feel it's really something that's very, very foreign and far away from them. Also, maybe ironically enough, they show also in studies that the higher the vaccination rate goes, the more people will get vaccinated. I'm not sure how to explain that. Maybe it's the fact that they see that more and more people around them are being vaccinated, so there's pressure to be vaccinated. But they show countries that get to a certain level of high vaccination encourages some of the hesitant people also to vaccinate. And lastly, access to vaccines also. The fact is, how accessible it is to get vaccinated. I come back to the example of Australia, where about 2 months ago, it was extremely difficult to get vaccinated in Australia. It was not easy. That's why you have such low vaccination rates also. It's only 25%, I think, globally, when last I looked in Australia. So the fact is that it was really hard to get vaccinated. So in Switzerland, for example, the authorities have facilitated that for many people. So that shouldn't be also discounted also. So this is just a brief summary. What we've also sort of learned that hopefully can be sort of considered when we're going, continuing to communicate in these, potentially next waves of COVID. I'll hand it back to Anissa for the conclusion.
What would you say, and how would you say it? Here are the next steps as identified by the CDC for their communications. Acknowledge that the war has changed. I think it wouldn't be a bad discussion topic. Is war really the analogy you want when people are so divided? And how do you acknowledge this? How much do you say? How much transparency? Improve the public's understanding of breakthrough infections, and part and parcel with that. And the next point, improving communications around individual risk among the vaccinated. Vaccine effectiveness. How much is too much? What should be said, what helps, and what harms, actually, when it comes to the truth there. Prevention, mandating healthcare professionals to be vaccinated. They suggest universal masking, and reconsidering community mitigation strategies, staying home, limiting groups, lockdowns. Let's talk about it.